Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is, what are the indications for undergoing spinal discectomy surgery for sciatica? First of all, what is sciatica? It occurs in 1 to 2% of the population at any given point in time. So at any given point in time, there's a few million of us who have sciatica, and most have no clue what they did to incite the pain. And what typically happens is you have a slow disc degeneration, and then you end up with some tearing and degeneration of this area here, the outer part of the disc. And then you have some of the inner gelatinous parts squeezing out, in the layman's terms called a slip disc, and then pushes on a nerve root and it gets inflamed. Okay? Sometimes that could be a sneeze, something as simple as that, bending over to pick up a pen off a table. So what symptoms result? Well, it could be leg pain, it could be a burning or a pins and needles sensation. It may be flat out numbness that occurs, and then possibly some muscle weakness. What you can see in this picture is evidence of a foot drop, where the person has difficulty lifting up the foot. Okay, that's a foot drop. And then rarely a person may get incontinence, which is difficulty with bowel and bladder function. So initial treatments non-operatively may include short bed rest, maybe a couple days. Anything longer than that's been shown in studies to be detrimental to patients. Over-the-counter medications like nonsteroidal anti-inflammatories and Tylenol, physical therapy, chiropractic treatment, spinal decompression therapy, all those have shown to be beneficial for pain relief when sciatica is present. Then there's the prescription medications, and that may include a Medrol dose pack, which is a burst of prednisone by mouth followed by 4 days of tapering off. Narcotic medications, muscle relaxers, neuropathic medications such as Neurontin or Lyrica can be very helpful. Interventional treatments include trigger point injections, which can help a lot with the spasms around the back. And then you have the gold standard of epidural injections, which you can see here, where steroid medication is injected around the area of the nerve being pinched, and it bathes the area with anti-inflammatory, soothing medication that can provide pain relief for weeks to months. Now, 95% of patients are able to get by with non-operative treatment. But there's 5% who end up being indicated for surgery, and there are 3 types of indications. There's absolute, where it's got to happen. It's an emergency, and there's no doubt about it. Then there's relative, where there's definite indications for it, but you don't have to have it necessarily right away. Then there's quality of life, which is completely elective, where you can get by without it, but it's a symptomatic. They call it an elective quality of life choice. Okay? So let's start with the worst case scenario, which is Cauda equina syndrome. Now look at the picture here. What you can see is this is the spinal cord, and then around L1, T12L1, it's not the spinal cord anymore. It becomes a structure called the Cauda equina. Now, if you look at it in real life, it actually still looks like the spinal cord, but it's called the Cauda equina. So if a person has, and here's in a cross section, if they have a big disc herniation and it's pinching on this area, it can cause what's called Cauda equina syndrome, and that can cause irreversible incontinence and difficulty walking. So when that starts to occur, it's a surgical emergency. A person needs to have surgery within 24 hours, at the most 48 hours, to try and stop the problem from becoming irreversible. Now, let's move on to a relative indication. So here's that picture again where the person has difficulty lifting up the foot. Okay? That becomes a relative indication, because the problem is that you can watch that for a few weeks, maybe a few months, but it's not clear over what period of time. If the person still has weakness and it goes and has an operation, is it going to get better, or is it permanently going to be a problem? It's unclear what that definitive time frame is. So some people wait 6 weeks, some people wait a maximum of, say, 3 months, and if it's still there, they'll go ahead and operate, because they want to make sure that the nerve root is going to get better and the person's going to be able to, lift their foot up or do whatever the muscle weakness caused. Now, the other relative indication, if it's progressive neurologic deficit, let's say it was a partial foot drop, where it was just weaker than the other side, and then it becomes a complete foot drop, that means it's getting progressively worse, and that becomes a more indicative of a relative indication for surgery. Now, elective quality of life. if a person has over 6 weeks of conservative treatment, such as with the medications, the PT, decompression therapy, such as you see on the right there, or injections, and if none of that is working, if the pain is just so bad that a person can't work, they can't function, it's just not getting any better, that as an elective quality of life decision, a person could go ahead and have surgery. And that's just an elective decision, okay? So what are the outcomes of sciatica surgery? Well, as mentioned, less than 10%, it's actually less than 5% of those with sciatica will end up needing surgery. Those who do, over 90% have good to excellent results with a discectomy procedure. The procedure takes about an hour. It's outpatient. There was a landmark study done in the Journal of American Medical Association that looked at those who had surgery and those who didn't and fell into that elective category. And they showed that surgery helped increase mobility and decrease pain faster, but at the 1 year point, the outcomes were the same, no different. So if a person can wait, then they can avoid any of the risks of surgery. Arizona Pain Specialist has the most comprehensive pain management in the whole state. It's really a one-stop shop. You have chiropractors, board-certified pain management doctors who have won the Patient's Choice Award for 5 years in a row. There's currently 5 locations that accept over 50 insurances. The number to call for scheduling is 602-507-6550. And check us out on the web at ArizonaPainNetwork.com. There's a lot of information on the website about sciatica, disc herniations, all different types of pain conditions and treatments. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.